I'm Andrew Dillion, and I'm the Chief Executive of an organisation called the National Institute for Health and Clinical Excellence. It's more often referred to as NICE, which is a very entertaining acronym to use. And the job we do is to help the National Health Service to make the best of the resources that it has available by producing a range of guidance on the best options for treatment, the sort of options that produce the best outcomes for patients and help the NHS make the best use of the money that it has available.
And how do you define achievement?
It's a really interesting question, because so often we think about achievement in terms of the job that we do, and it might be quite easy for me to define that. I know what I have to do at NICE, I know how the success of the organisation's judged. We very quickly find out whether people like what we do or whether they don't through the response we get from the NHS and in the media. But I think we sometimes forget that achievement is much more broadly drawn for any of us than just that, and it's what we do with our lives, not just what we do at work. So talking about being able to create a family life that's been so rich and so rewarding, and being able to steer two daughters through the first 20 and 17 years of their lives has been an extraordinary privilege, really, and easily the best thing that I've been involved in. Well, like most people, it's a combination of a bit of luck, just sort of chances that you take or don't take in life. I mean, presumably some ability to do the things that I do. But I did a geography degree at university, so completely unrelated to actually the career I had before I came to NICE, which was in hospital management. And that's what I trained to do when I left university. I went on a graduate training scheme that the National Health Service ran then and still does run. And then I got various jobs running hospitals in the NHS, and did that until I joined NICE, which was about 13 years ago. And NICE was a very different kind of job. It's a very different job running an organisation that actually only employed me when it started. I was the first employee through the door, from one in which I had been employing 5,000 people with an enormous budget. So it's a very big contrast. Running a big hospital it's got to be about the worst job going. I mean, the best job and the worst job. The pressures are enormous. It's hugely challenging, much more challenging now even than it was when I stopped doing it 13 years ago. NICE was very different. It didn't have that intense pressure of 24 hours, 7 days a week, thousands of people making decisions, any of which might generate a problem or an issue or a challenge or something that, as chief executive, you would need to be involved with. At NICE, there's a less immediate impact, but it has its moments. What we do really matters because it influences what we all, as users of the NHS, might ultimately get from the service. It matters because, though it places limitations on what the NHS offers sometimes, it's pushed the NHS to do much more quickly than I think would have been the case, based on all the experience I had in working in the NHS. So I don't know, what would the public think? I mean, I hope they think, well, it's an organisation that's, though it's got a difficult job, sometimes a controversial job, perhaps a job that some people might think shouldn't need to be done, that it nevertheless does it well, and that as chief executive I've done my best to steer it through and keep it going for so long. I'm often asked the question, well, what if it was you, or if it was a member of your family? Surely you would want to get access to the drug, or to be able to benefit from the particular form of practice that's at issue. To which my response is, yes, I would, as an individual. Anything, you get to the position, particularly when we reach the end of our lives, and so what we're looking at is not a cure that's going to give us another 20 years, but a drug that might give us another 3 months or 6 weeks or even 2 weeks. It's entirely a human response for us to say, well, I want it. For most people, not everybody. Some people reconcile themselves at that point to the end of their lives, and I'm no different from anybody else. If it was me, or if it was one of my daughters, or if it was my wife, I would feel exactly the same way. But because of the job I have to do, I have to both recognise the reality of that entirely human and understandable response, with the fact that the NHS, in fact no health system really, where people are pooling their resources through taxation as it is in this country, or an insurance fund as it might be somewhere else, there are always going to be some limitations on what the system can offer. And if it means making choices about what the health service can offer, it's far better to do it in the way that we do it now. It's very publicly, very accountably. We open ourselves to challenge. We explain, as I do, to the media the basis on which the decisions. To do it that way, then the way it used to be done in the NHS and is done in many other countries where these decisions are taken quietly in the background and their basis is not obvious. So you're absolutely right. It is a contradiction that what I would want for myself and what I recognise, given the nature of my job, that through a good quality process has to be determined for the NHS based on the fact that it's got limited resources. I mean, in a number of different ways, there's a sort of tendency to revert to the norm in the way we behave, in the way we dress, in our expectations of the things that we can do in life, our assumptions about the limitations that we have as individuals and how that restricts in what we do. And then there are, and that's probably true for most people, though we might all fight against it a little bit to try and accentuate and take advantage of our individuality. I think there are clearly some people who just revel and celebrate their individuality. I was listening to a podcast by Grayson Perry, the artist, and it struck me, just thinking about your question and my response, it strikes me that he's probably an example of one of those people. I mean, a very interesting life that he leads. He's very open about the fact that he's a transvestite. He's also a father. He's got a teenage daughter. He talks about how she responds to that. He's an extremely successful ceramicist, but he's also a very public figure and has celebrated his nature and his ability to attract attention and to find an audience for his view of life through the TV programs that he's done and the radio broadcasts that he's made, which I think is great. So I think he's one of those people that's outside the curve, the bell curve that you described, in an admirable way. I think it's great, and we need people like that. So there are those of us who might fight very hard but may not get very far from the norm, and there are some people who just absolutely enjoy the fact that there's no magnetic attraction to that norm at all. And they're just different from the rest of us. You're right. You could get lost completely in trying to resolve every tiny problem that the NHS has. It's just too big. There's a million people doing things in the NHS. There are millions and millions of patients every week engaging with the NHS. More still with social care too. So what you have to do is to think, well, we can't be there in every interaction with quick access to the evidence base for the best solution for that individual patient or client. What we have to do is to think about what the evidence suggests is going to work in the best interest of the majority of people who present with particular circumstances, with a particular disease or condition, or with a combination of diseases or conditions, and then draw up advice for the health service, but always with the caveat that in the end it's not an instruction to practice. So that when I go and see my GP, that the interaction I have with my GP is about me and my very particular circumstances. I hope my GP does her or his best to keep up to date with the evidence, and I hope that NICE makes a contribution to helping them do that. But ultimately, the decisions about our health and the best way to lead our lives, we need to take ourselves on advice from professionals involved. I do remember when I first moved to, I suppose, the biggest job that I had, the last job I had in running hospitals before I came here, which is as Chief Executive of St George's Hospital in southwest London, which is a big teaching hospital lots of staff, all sorts of things going on, a whole range of services, things going wrong as well. I remember in the first few weeks of being there, being very conscious that I needed to establish not so much a reputation, but I needed to establish my presence, to some extent my authority, although the office itself carries a degree of authority that you simply just inherit. But I needed credibility, perhaps that's the word. I needed to establish credibility in that role. And there were times in the early days when I wondered whether I was going to do that. I'd come from another big hospital, the Royal Free, so it wasn't that I didn't know the environment. But when you've got the top job, it's a very lonely position. Everybody's looking at you. Everybody has their different expectations. And hospitals consist of quite diverse communities of people with very different backgrounds and very different expectations and attitudes. So I do remember that was quite a testing time. But I stayed there for 8 years, so I must have got through it. It's less loneliness, it's just an acute sense that it will be your responsibility and you will have to live with the success or failure that flows from the decisions that you take. You become very conscious of the character of the people around you as well. You immediately find those people who care enough about you to stand by you in difficult circumstances. You know, to hang around at the end of a meeting and say, is there something I can do? Or have you thought about this? Or look, if you want me to help, I'm very happy to do that. And I can recall examples of where that happened, and you're very acutely conscious of that, and of those people who are hostile or just don't really care one way or the other. But in the end, you know, it is that sense that you'll live with the responsibility, and it'll affect you and your reputation in the future that's, for some people, becomes very corrosive, actually, and they find it very difficult to deal with, and sometimes finishes their careers. But for everybody, whatever they might say, however, you know, bullish they might be in their sense of being able to cope with this, will certainly feel.